John was a banker and a businessman, and he did a lot of work for both Bellin. He was on their board and treasurer, and he was on the executive committee with the Green Bay Packers and also treasurer. The award was created as a partnership between Bellin Hospital and the Green Bay Packers. He was gratified that they were going to do that, but that was not his idea. We received a call the night before he died that said that they wanted to do this to honor John. And I think he would be very happy with all the people that have been chosen.
If you would have told me my dream job would be being in healthcare philanthropy when I was 18, I think I could not even imagine how that would come to be. And I can tell you this job, this role that I get to be a part of now is absolutely for, just the time in my life that it hit was just the right time, and is now something I hope I get to do for a very long time.
The Bellin Health Foundation is the fundraising arm of the Amplify Health by Bellin health system. So we exist solely to bring in external dollars and support and funding for the services, people, and programs and patients of our region's health system. Philanthropy really is the place that steps in when there's a gap in the operating dollars, right? Where's the innovation? Where's the next level up that donors want to see? And that's where philanthropy can exist.
Well, I thought I wanted to be a wedding planner, so they don't have a major for that. So I went to Madison for school, majored in journalism and public relations, so that has served me very well throughout my career, because I think in all the roles I've had, you have to be an effective communicator. My first job was pretty much working for Downtown Green Bay Incorporated, so it's a little nonprofit organization, still exists today, that I got to be a part of planning all of the downtown events and kind of the revival of downtown, when the city deck opened and all these things. So that was really my career for about 14 years until I left there. I did a chapter at UW Green Bay working in the athletic department. And then of all times, my first day at Bellin was March 30th, 2020, having never worked in healthcare before. So it has been a journey, and I did not start in the foundation. I started actually working with Randy Van Straten and Sherry LaFawn and Kathy Kirschner's team over in the employer clinic world.
I'd worked with Bellin for several years on the quality committee, as a volunteer, working on the board. So I was aware when Molly first came to the organization and her work with COVID and the way she just stood up and marched through the organization and got people to volunteer, to do testing and got things organized. I mean, that was a chaotic time, and Molly took charge. And here was this young woman, and I'm sure people were going, who is that? What is she doing? But they followed her because she had a purpose, she had a goal, and she had a way of engaging people with her spirit and her energy that made them want to do it. When she joined the foundation initially, I thought, what a great fit. Her background with Downtown Green Bay, her background at UWGB, and I'd worked with her low there, and she really brought some depth to the foundation.
The foundation really gets involved in three main areas in our health system: in philanthropy, in grant funding, and in volunteer services. So my day and my role as the Bellin Health Foundation president is to try to grow those three sectors in every way, all to benefit Bellin region program services, supporting our staff. A lot of people say, Molly, I could never do your job. And I always say back to them, well, yeah, if I were making cold calls all day, I wouldn't want to do this job either. That's not what we do. I'm not selling something to someone. I am meeting donors, hearing their stories. All of them have connections to us already. Like, we are not talking to folks who, live in California, have never experienced anything here. We're talking to people who had unbelievable experiences with care teams here. It's finding that donor and that family who had a connection to mental health, who had a family member get treated for cancer here and wants to support that latest technology that we had. So that's where I think the magic happens, is when you find those people that have the passion matched with a project that we really need help with.
She loves her job, and that, I think, is what drives real results. She's able to connect with people in a way that I have never seen. She builds real, genuine relationships with people. She understands what matters, and she connects with the people, our colleagues, doing the important work in the health system, and she knows what's going on and how she can take that beautiful work and match it with what a donor truly cares about. And that is why donors believe in her, and colleagues trust her, and her team sees the importance of the work that we do every day.
When I found out about this award, my first reaction was, this is so cool for our team, because I, get to sit up here and be the one that accepts it, but it is totally a reflection of what our team has been able to do these last 5 years together. I'm so lucky to be in this community. I think about the John Underwoods of the world and these pillars who have been incredible leaders. We, little Green Bay, Wisconsin, we are bigger than we should be. We have more amenities than we should. We have amazing healthcare. We have incredible leaders and businesses, and all in this little community of 250,000 people. And so I feel incredibly lucky to get to live here, number one, and we have amazing people in this community. I feel very, very lucky that I've gotten to know so many of them.